We are talking to Professor Surujpal Teelucksingh, the Anthony and Sabga Caribbean Awards for Excellence Laureate in Science and Technology for 2011. Professor Teelucksingh is a doctor. He's a medical doctor, a researcher, a clinician, and a teacher at the Mount Hope Medical Sciences Complex, the School of Medicine. Good morning, Professor Teelucksingh. When we spoke previously, you said your work, your research, was largely focused on things that might easily be missed. Could you tell us a little bit more about how you became interested in those relatively small seeming problems?
Yeah. Well, thank you very much, and thank you for inviting me to talk about my work. You're quite right. I did emphasize that my research and my work has been largely intuitive. I've picked up on things that I felt needed to be done to elaborate a particular problem that was of interest to me and hopefully of interest to people in the broadest sense, to my nation and perhaps the region. And yes, let's take one example, and that is diabetes among children. That particularly intrigued me, not because diabetes is uncommon among children, but the type of diabetes that we were beginning to see here was unusual for children. And that first occurred about 10 or 12 years ago when, out of curiosity and interest, I felt it was necessary to set up an endocrine service that catered to the needs of children. And I was amazed as to the number of children who were presenting with diabetes. And diabetes is not the type that children normally got, which is type 1 diabetes, but essentially the type of diabetes that their parents or grandparents should be getting, type 2 diabetes. And that intrigued me, and that's really what stimulated a great deal of my later work.
You've been involved in Diabetes Education Research and Prevention Institute. That's a foundation to promote diabetes education in school children, particularly. Could you tell us a little about that?
The Diabetes Education Research and Prevention Institute came about simply because of a charitable gesture by one of our leading businesswomen in the country. Helen Bhagwan Singh gifted our university close to $1 million US. And that really was the fillip, that was really the catalyst for the kind of work that we're now producing. And yes, in the first instance, we thought it would be important to target school children because after all, they're the next generation. And you know, in my view, there is nothing better than empowering the next generation to solve the problems of the next generation.
Let's just digress a little bit and talk about your own schooling. You told me a story of yourself at Presentation College and a little situation with Principal Brother Leonard and how you first became aware that you could actually change the destiny of the country.
Well, it's interesting you should bring that up. It's interesting you should bring that up. I feel as a nation, we undervalue the importance of teachers. And we undervalue, I think teachers themselves sometimes undervalue their own very critical and important role. And the story I related to you occurred when I was about 14 or 15 years old, when my school principal challenged us to perform a simple task for him. Take a very heavy table, mount it up a windy stairs up to the library upstairs, the staff room, if you know Presentation College, you go on. And during the course of transacting that engineering feat, we had some difficulty. And he looked at us all, about 5 or 6 young men who we were taught we were strong and able-bodied, and had difficulty negotiating the passage. And he said, now, I don't expect you all to give up on this. You're the future leaders of this country, and you'll have to solve the problems that this country provides in the future. And that did 2 things for me. I never thought myself as a future professional, and I never envisaged that I would one day be asked to perform the job of finding solutions to the nation's problems. But here at age 13, a teacher was seeding that idea into my mind, and I remember it as a very important event.
And this principal was Brother Leonard Dennehy of Presentation College, Chaguanas.
He was a fantastic man and a fantastic teacher, and as there are many still fantastic teachers around.
And you yourself are a committed teacher. Your dean, Professor Ramsewak, told us that your students are very motivated by your lectures. Could you tell us a little bit about your work as a teacher, as a trainer of doctors?
Teaching really is storytelling. I've grown up in a culture of storytelling and a culture of storytellers. When you grew up 50 years ago in a village like Kunupia, you had no choice but to listen to good stories, especially if you grew up in a little shop where people would come for exchange. It was a great place for storytelling and for learning. And if I am regarded as a good teacher, it's simply perhaps because I'm a good storyteller.
Okay. So there's been a perception in Trinidad that doctors, particularly young doctors, lack that kind of communicative compassion, which again, your dean and several of the people we've interviewed on your behalf have indicated that one of your great gifts as a doctor is that you are compassionate and you listen. Could you tell us, now to repeat, there's a lot of criticism of doctors in Trinidad for the lack of those qualities. Could you tell us a little bit about how you try to instill those qualities in your students?
Our educational system has traditionally been very didactic, top-down. Students are to listen and to learn. And the reverse process of students engaging in conversation is not the norm, certainly not up to secondary school level, certainly not the education that I experienced. Nonetheless, I do feel that you are right, that communication is a highly valuable commodity, especially to people in need. And I would like to emphasize that that must be a continuing frontier in our training of doctors. We must encourage and strategize as to how we can improve communication. Our medical school, my medical school, values that facet of training and has invested considerable time and energy into correcting that evil, if it is an evil.
Issues that you've identified seem to be around what is called public medicine, public health medicine.
Yes.
And you've also said that public health, well, not you, but many people have said that public health medicine that affects the health of the general population rather than specific diseases is the future of medicine, or is the present critical area in medicine?
In Toronto, for example, in Ontario, the province of Ontario, Canada, I gather you trained there, it is estimated that within a few years, 80 cents of every tax dollar will go into their health budget. That's not sustainable.
No.
As a result, what they have thought of is dividing their Ministry of Health into that which has to do with institutional care, which is the traditional emphasis of medicine, wait for people to become ill and then start to treat them, or take a slice of that budget and invest for the future in preventive health, in preventive medicine, diminishing or reducing the prevalence of disease in the population and reducing the queue for those wishing to enter hospital. And that's their strategy for coping with this impending and imposing calamity of cost to the healthcare system.
And that applies to Trinidad as well,
Well,
and the Caribbean, I think.
Well, I think it will be a reasonable strategy, and quite frankly, that's what has worked for the infectious diseases. I mean, the infectious diseases have been largely eradicated in the country, apart from HIV and now a resurgence of TB. But infectious diarrhea, infectious chest infections, hookworms, mentioned that earlier. A public health approach is what solved those problems. Making water, potable water, widely available was the single most important public health intervention that transformed disease in the world. Of course, many parts of the world still don't have good potable water, and there are parts of this country that doesn't have it. Mm-hmm. But simple measures like that can have tremendous impact. The old hygiene of having potable water and treating infectious disease has now to be translated into the new hygiene of teaching people dietary and physical activity habits that will reduce the scourge of the chronic diseases.
I understand that you have recently been awarded a grant to do surveillance on just that issue for the entire region.
Absolutely.
Could you tell us a little about that?
Surveillance is like good police work. I mean, it's better to prevent crime than to allow the crime to occur and then try to appease relatives or people who have been victims of crime. So it is in medicine. Good surveillance will give us that advantage in recognizing disease before it occurs and in using interventions before people get into trouble. And essentially, that's what good surveillance will do, and that's what this grant is about.
Who is it from?
It's from the IADB, the Inter-American Development Bank. It's a cross-regional project. It involves 6 CARICOM IADB countries. And we're setting up the structure. Not that the structure has not been there. The structure has always been there for surveillance, mostly for the infectious diseases. But we're now bridging into the chronic non-communicable diseases. And CAREC-PAHO has been mandated to do surveillance work in the chronic disease. And we are partnering with them to enhance the process, bringing technology into place and refining the process of data gathering on chronic non-communicable diseases.
Where do you see this, how do you see this impacting the Caribbean in, let's say, 5 to 10 years?
This country went into development phase about 50 or 60 years ago and can teach a lot to countries who are now undergoing the kind of development that we have undergone. And in fact, we are a small country, but the evolution of the diabetes epidemic in Trinidad has taught the world a lot. Mm-hmm. When Dr. Surujpal King in the 1960s did a national study on diabetes in this country, he had found that even 50 years ago, that the prevalence of diabetes in Trinidad was already the highest in the Western Hemisphere. Now, the developmental model that occurred here can teach countries now about to undergo that kind of transition and transformation important lessons. By engaging our population, our school population, in the fight against diabetes, I think we're developing a model that we wished to share with other countries in similar modes of development. And we have many other countries in Asia, in the Caribbean, in the Pacific, that are now undergoing that kind of economic and epidemiologic transition, and we could work. We intend to understand this model, develop it better, and to share it.
But this is an expensive process, and funds are not forthcoming. How do you see attitudes to that changing, and do you have any suggestions as to how to divert more funds into research?
Yeah, I do not think that health has traditionally been viewed as a resource that's valuable, in the same way that the environment was never viewed as a valuable resource. And all of a sudden, we're putting a lot of investment into the environment. I think the time is coming when populations and when investors are going to see health as a resource, in the same way that raw materials are, in the same way that the environment is valuable. The greatest natural asset that any country has, it doesn't matter what their physical assets are, it's human resource capacity. And if we can have citizens produce long and productive lives, the country is richer for it. And I do feel that the tide is turning, and projects like the ones we are doing and others might show people the economics of healthcare and the value of investing in health. For example, we are able to show that if we identify one school, the cost of identifying one school child now with diabetes and intervening with simple interventions might yield exponential benefits, exponential economic gains in as early as 10 years' time. So it is a delayed investment, the outcomes of which are not immediately obvious, but they're real and tangible. We just have to stretch our horizon a little bit longer.
One of the areas of complaint is that doctors are not held accountable for the mistakes they make, not through human error, but through negligence. How do you feel about that?
Yeah, I think all good citizens, whether they are doctors or not, have a responsibility to recognize when errors occur, to take remedial action, and to accept responsibility when those errors occur. That's not just a mandate for doctors, that's all good citizens, but especially with doctors. And I do not believe that noise and hubris should take the place of debate and argument. Now, doctors are at the forefront of a situation. They're really at the battlefront in war, and they are held accountable and liable. But often, and I'm not making excuses, they are not empowered. They are subject to the various vagaries of a complex system upon which demand exceeds supply. I think it's no secret that the demand for health care in this country by far is in excess of that which can be supplied, both in the private and the public sector. And it's because health infrastructure has not really advanced for very many years. there have been few significant changes in healthcare delivery in this country for a long, long time. So there is creaking infrastructure, and I do not wish to in any way minimize the role of the doctor in the system, but often I feel that doctors need a little more empowerment. I think all healthcare workers need a little more empowerment. And I do feel that they're the first one to be targeted, right, because they have a responsibility, but it's also because they are the face of the healthcare system. And understandably, people will lay their frustrations on them.
Professor Surujpal Teelucksingh, thank you very much for your time. Professor Teelucksingh is the Anthony and Sabga Caribbean Awards for Excellence 2011 Laureate in Science and Technology.